Now, islet transplantation is moving very fast in all continents except United States, because here we have a challenge with the Food and Drug Administration that still consider islets like drugs, and who provides islets like a drug company, imposing a regulatory burden that doesn't allow us to proceed very well. But all the people we train worldwide are moving very fast from Australia, Europe, Canada, Asia, and they're already presenting data on randomized prospective trials showing superiority of islet transplantation to insulin infusion system like artificial pancreas or intensive insulin treatment, like in this case, showing % of patients with hemoglobin A1C less than 7 being huge, like over 80% in the islet transplant setting, and almost nothing in the intensive insulin treatment, and so far for all the other parameters. This is very encouraging. Also, the comparison with artificial pancreas versus islet transplant. If you look at the timing and range with the Diaby-Loop or the other devices being considered successful, if you have 75% timing and range, while with islet transplantation you can often achieve over 95% timing and range, 6 months or 3 years. So very encouraging results. The problem has been that despite the spectacular metabolic control that you can achieve in diabetes, you still need anti-rejection therapy. So this is what you can achieve now in islet transplantation to the right, in long-term insulin dependence cases with no severe hypoglycemic episodes and over 95% timing and range of glucose control. And this has been very encouraging for the field. Now we are entering a new era of clinical trials where we try to progressively replace and eventually eliminate anti-rejection drug immunosuppression. And this is a trial from Eledon Pharmaceutical that will start soon, have been approved by FDA. Eledon developed an anti-CD40 ligand monoclonal antibody, which is a co-stimulatory blockade strategy that we have been working at the Diabetes Research Institute for over 2 decades to get this at the clinical stage ready level where we are now. And thanks to Dr. Norma Kenyon and our team at the DRI, we were able also to provide critical preclinical data to enable the Eledon Pharmaceutical clinical trial that is now in progress. So we are looking forward to these results, and the idea is to replace program immunosuppression, traditional immunosuppression that you see here to the left in red. Stimulated C-peptide has been relatively low with this immunosuppression because the anti-rejection drugs can be diabetogenic themselves, imposing a 2.5 metabolic demand, increase in the metabolic demand compared to no immunosuppressed patients. So the ability to just replace program immunosuppression with this anti-CD40 ligand in preclinical model has allowed more than 3-fold increase in insulin secretion from the transplanted islets. So we're very anxious to see the results of this potentially breakthrough clinical trial. We are also working with Poland to help Piotr Onowski and his team with innovative therapies treating type 1 diabetes with expanded regulatory T cells that are the cells that maintain tolerance to try to block progression of autoimmunity and type 1 diabetes in patients at the onset, and now even to try to prevent the clinical onset of type 1 diabetes. So this is another trial that we are very eager to see start and continuing with already very encouraging results in the initial clinical trials with follow-up of several years, where they show that this is definitely a very encouraging new strategy for tolerance induction in type 1 diabetes, avoiding the destruction of the insulin-producing beta cells. We also are heavily involved, and I've been chairing the steering committee of the Vertex trial, that is the first clinical trial that show insulin independence following transplantation of a stem cell derived islet cell product. And this was like presented in Stockholm at the ESD conference, that is the largest diabetes conference worldwide with over 23,000 delegates. And we were able to show very encouraging results with these patients that moved from 8.6 hemoglobin A1C and 34 units of insulin to insulin dependence, 0 unit, 5.2% hemoglobin A1C and 99.9% time in range. Spectacular results as far as metabolic control. But these patients, this trial still require anti-rejection therapy. So one thing that we're now concentrating on, both Vertex in the new generation trial with a macro device that will be immunoisolating, allowing transplantation hopefully to occur without immunosuppression, as well as a strategy that we have developed to bioengineer an intra-abdominal endocrine pancreas in the omentum with a biologic scaffold that allow us to show for the first time that you can achieve insulin independence in a site that is not the liver, that is traditionally the site that has been used for islet transplantation. And this has also produced very remarkable results clinically with a very good timing and range, over 90%. And the purpose of this strategy was to combine it with something that could induce tolerance. And this is, I'm happy to report that it has been recently published in Science Advancements, that this technology using a microgel that is composed of a streptavidin Fas ligand fusion with a PEG biotin microsphere to generate this kind of microsphere that resemble like a COVID virus, SARS-CoV-2, but only much bigger because it's 150 microns, where instead of the spike protein, you have the red part is the Fas ligand molecule. That what it does when you combine this microgel with islet transplant and you put it in the omentum in this biologic scaffold, it allows you to induce apoptosis of that is programmed cell death of the lymphocytes that come to attack and destroy, like to reject the islet transplant. And this, for the first time, has allowed islet transplant to survive for several months without any recipient immunosuppression used chronically, only as a short-time induction. You see the line, 100% survival of the islets without immunosuppression. So this is a remarkable result that is now moving towards clinical trial, and we hope we will be in clinical trial in 1 year. Now we're involved in the manufacturing of this Fas ligand microsphere with the PEG biotin construct in a CGMP, current good manufacturing practice, like a drug manufacturing situation, and it will, I believe, in 1 year we'll be able to move in towards the clinical trial that will be highly anticipated. This is another trial we're doing in collaboration with Ospedale Niguarda in Milan, that is testing a new kind of micro encapsulation technology without any immunosuppression, to try to transplant islets also without immunosuppression. This will be another strategy besides the high tolerance Fas ligand strategy. So far, we didn't have success yet, but there is more to come in the next few months, and I'm sure you'll have update in the next year on the evolution of this potential breakthrough strategy conducted in Milan at Ospedale Niguarda. So now, stem cell-based therapy for human diseases. We know there are several kind of stem cells, from the embryonic stem cells to the inducible pluripotent stem cells that can be derived from adult cells. There is also a large amount of mesenchymal stem cells that can be sourced from different tissues that are more and more tested for clinical trial applications. And stem cell-based therapies for human disease can now rely also on large sources of perinatal mesenchymal stem cells, like placental structures, like placental membrane, amnio, chorion, amniotic fluid, umbilical cord derived, that is what we are focusing right now. And this is quite an amazing resource, because you have to think that from a single umbilical cord, we can derive like enough cells to treat over 10,000 patients. So it means that unlike organ donation from multi-organ donor, when it's like would become kind of a lottery system, if we want to treat all patients with diabetes, with umbilical cord derived stem cells, we have none of such limitation. We could, like in our hospital alone, we have 10,000 newborn a year, and if each of them can treat 10,000 patients, we'll be in a very good shape with no limitation of source. And these umbilical cord MSCs are very effective in blocking hyperimmune, hyperinflammatory responses. They have a very strong anti-inflammatory profile, and we've been lucky to be able to generate these cells from umbilical cord and work towards their clinical application that has been already tested in very successful clinical trial. You can, as I mentioned, process the umbilical cord, expand these cells, cryopreserve them, and have them ready for infusion IV in a patient for the target clinical application. We've been involved in MSC studies since the 90s, first for chimerism and tolerance induction in transplant to prevent transplant rejection, like they have been used by others to correct and treat, prevent graft versus host disease. Then we use them in kidney transplant, randomized controlled trials, and more recently in treatment of long-term diabetes, in Alzheimer. And then when the COVID pandemic erupted, we also have a COVID trial. So this has been an unusual circumstance, because when COVID erupted, we had to rapidly convert. We couldn't do trials in type 1 diabetes or Alzheimer, but we have a unique cell source that could be tested to treat the most severe cases of COVID-19 when patients were in the ICU intubated. And thanks to the North American building trades unions support, we could expand the production and start this clinical trial together with sponsorship from the Cure Alliance. And we were able to show that these umbilical cord-derived mesenchymal stem cells were able to save 100% of the patient treated below age 85, including 100% of patients with diabetes. And unfortunately, the control group, where they receive only the solution without the cells, because FDA approved us, but they wanted the control group. So it was a randomized, prospective, double-blind, placebo-controlled trial. So the most rigorous trial that you could perform, where neither the patient nor the doctors know if the patient receives stem cell or the control solution. And unfortunately, the control group had less than 50% patient survival at 1 month compared to the 100% survival in the stem cell treated group. And also time to recovery was most patients, majority of patients recover within 2 weeks in the stem cell group, while the few who are still alive in the control group were still in the hospital, most of them at 1 month post intervention. So what is significant for type 1 diabetes and autoimmune disease is that we were able to demonstrate not only safety of the strategy, but also the immunomodulatory efficacy of this treatment, and allow us to develop new methods for mechanistic analysis and scale up cell manufacturing, create a multi-center network, and now we're ready to test these cells in many other applications. So what we show is these cells have a powerful anti-inflammatory immunomodulatory effect. They reverse the cytokine storm in severe COVID, and this is exactly what we wanted to prove, to show how now this can be applied to type 1 diabetes as an autoimmune disease, to block progression when you have an hyperimmune, hyperinflammatory situation, like at the onset of an autoimmune disease such as type 1 diabetes. Also, they've been not only modulating immune and inflammatory response, but also have been shown to promote tissue regeneration. And this is a very important study that we recently published, showing that in long-term type 1 diabetes, subject treated with this kind of stem cells, you can almost completely block progression of chronic complication of the disease. So both neuropathy, nephropathy, and retinopathy. In the black, you have the stem cell treatment group and the randomized control group in gray. And you see what a dramatic effect you can have with these stem cells in prevention of chronic complication of diabetes. So we said if you can prevent chronic complication of a accelerated aging disease such as type 1 diabetes in the long term, what about reversing this complication in a true healthspan medicine context to try to prevent altogether the development of this kind of complication and reverse them when they start appearing? This is another very important paper that we published recently, showing that if you consider the age-related dedifferentiation of pancreatic insulin-producing cells in long-term diabetes, these are from human type 2 diabetic subject long-term, that they undergo this so-called mesenchymal transition, which means is a dedifferentiation, like in many other aging situations where specialized tissue lose the ability to produce and to function as a specialized tissue. In the case of long-term diabetes, you can have this dedifferentiation, so-called mesenchymal transition, where the green cells that produce insulin are progressively replaced by red cells that are like not insulin producing or dedifferentiated. And what we have shown that if you combine these cells with umbilical cord mesenchymal stem cells that come from a newborn baby at time 0, they're able to bring them back to youthfulness, like if the cells come from a 30-year-old, and able to restore insulin production at an excellent level. So this shows that it's possible to reverse the biologic clock of aging and the differentiation just by putting the cells in contact with mesenchymal stem cells that come from newborn babies at time 0 that can crosstalk with the damaged cells and restore their functional integrity. Very important results. Now we're being just approved by FDA to start a new clinical trial of intrapancreatic infusion of these perinatal tissue-derived cells for treatment of type 1 diabetes at the onset. So we're going in January, we'll start enrollment of 18 subjects age 18 to 35 years with a diagnosis of type 1 diabetes within 6 months, and at least 2 antibody positive to confirm that is an autoimmune form of diabetes. And they will receive these perinatal cells via pancreatic artery infusion, and we're very happy and eager to start this trial that was recently approved by the Food and Drug Administration. This now to go to islet transplantation long-term results. What we have observed and recently published last year is that despite the use of anti-rejection drugs, islet cell transplant has resulted in a spectacular cumulative patient survival for 20 years. So it means that even if you use chronic immunosuppression, if you are in an age range of 40 to 50 years of age, you would never give immunosuppression to a child or a young adult because of the risk of immunosuppression if prolonged for decades. But if you're already 40 or 50-year-old, this could even be considered a life-saving procedure, because in diabetes, in the equivalent age range, your expectation of survival at 20 years is less than 60% if you look at what has been published so far. And these are not even the higher risk patients like with transplanting islets that are like the one with severe hypoglycemic episodes and so on. So this is not a randomized compared trial, is so 85% versus less than 60% is based on published results, but is encouraging to us because it means that despite chronic recipient immunosuppression in this set of patients with adult patients, you would not do it again in children, because children and young adults for the first 3 decades are doing pretty well. But when you get the phase of decline of type 1 diabetes, it could be considered certainly as a potentially life-saving procedure. So this is, as we know, diabetes is considered an accelerated aging disease. It was called the invisible killer because people children diagnosed with diabetes before they're 10-year-old or younger, they lose, practically they can lose 2 decades of life, between 14 and over 20 years of loss. So this is clearly an accelerated aging disease, but you don't see it at the very beginning, in the beginning decades, but you see it after you cross and you start advancing towards later chronological age decades, where the phase of decline start occurring. So why people with diabetes can still have accelerated aging is, despite you can achieve tight glucose control, what drives this kind of inflammation? It seems that it's not just glucose, but also elevated fat derivatives and defect in mitochondria. So that these are all subjects that I address in this book that I recently published, also in English, was a bestseller in Italy, that I'll leave you the QR code, so I don't have to speak again about this book in the talk. But for anyone interested in learning a lot, or if you want to give it as a nice Christmas or holiday present to someone you want to help, please share. And of course, don't share to anyone you don't like or didn't do anything to help in life. So what is the challenge that we discuss in this book and in our research? That in 20 years, the population over 65 will double. And after 65, 90% of the population suffers from one chronic disease. Over 75% will suffer from 2 or more comorbidities. And these age-related diseases include diabetes, respiratory, COVID-19 complication, neurodegeneration, cardiovascular, osteoarthritis, and cancer. And this disease, besides the human suffering, they're accounting for 90% of healthcare costs that now are $3.8 trillion a year in the US alone, or 20% of the GDP of United States, clearly a trend that is economically unsustainable. So with aging, there is this progressive loss of the ability to repair and regenerate tissues. And the important thing is, besides human suffering, if you increase healthy life expectancy by 1 or 10 years, you benefit the global economy $38 trillion to $370 trillion, in addition to preventing human suffering. So some of the causes that can be greatly related to this unhealthy lifespan are insulin resistance, that is not associated with diabetes, but you have a lot of subjects that walk around with insulin resistance and don't even know that they have it. And what we discuss in the book is how to assess your trend towards insulin resistance or your insulin resistant state, because while insulin resistance can be induced by several causes, from obesity, chronic subclinical inflammation, low level of vitamin D, excessive consumption of sugars, or oxidative stress and so on, lack of polyphenols and sirtuin activators, the consequences can be quite devastating, because you can have accelerated aging, decrease of healthy lifespan, kidney disease, you can have hepatic disease, increased risk of cancer, neurodegenerative hypertension, arteriosclerosis, metabolic syndrome, and type 2 diabetes, and so on. So it's really a very important risk factor to address. So why we are arriving in this situation? We found that we have been facing the last decades the perfect disease predisposing storm. So we have witnessed increased omega-6 that are pro-inflammatory, increased refined carbohydrates, increased processed foods, and we have decreased protective factors. We decrease the omega-3 in our diet, decrease polyphenols and sirtuin activators that are protective, decrease vitamin D, and decrease physical activity and exercise that is also a phenomenal risk factor. So this paper on the EPIC Norfolk study on thousands of people followed for a decade, they show that there are simple health behavior that can contribute to up to 14 years improvement in the healthy lifespan potential compared to zero health behavior in reds. And these are very interesting because are not difficult to achieve. So it's like absence of smoking, no smoking, vitamin C level greater than 50 microgram micromole liters, which is equivalent to consumption of 4 to 6 portions of fruit and vegetable a day, or you take 1 gram of vitamin C if you cannot access fresh fruit and vegetables. You have to have moderate physical activity. It's not necessary to have strenuous exercise, but just moderate physical activity, improve it, and consumption of moderate volume of alcohol, like 2 servings per day or no more than 14 servings per week, which means serving is like 150 milliliter. Is not a big Coca-Cola glass like in the United States. Sometimes you see as wine glasses. So what is the concept is that if you want to improve your health span potential, you have to be careful about diet, nutrition, but also other components that are equally important. So if you have an inflammatory diet, you don't understand what's going on because you can feel perfect. This could be a football player or some that is taking an incredible Western diet but feel very strong at age 40, but has already wiped out 2/3 of his regenerative repair mechanism potential, his stem cell potential. Well, the guy that maybe looks more like a nerd, is not very well built, is working the computer, but maybe is vegetarian or semi-vegetarian, is following an anti-inflammatory diet, still have 2/3 of his lifespan potential. When you hit age 70, the guy above with the inflammatory diet wipe out his regenerative potential, and bad things start happening, neurodegenerative, cardiovascular, all kinds of disease, chronic disease linked to unhealthy aging, while the guy below is still enjoying 1/3 healthy lifespan potential. So this we discussed already, insulin resistance, but you say, so why not just taking all these protective substances from healthy nutrition? This is what we are discussing extensively in the book. Is the problem is that unfortunately, if you want to assume 40 milligrams of resveratrol a day, you would have to consume 10-12 liters of red wine or 27 liters of white wine a day, or 30-60 kilograms of black grapes, or 22 kilograms of peanuts. So it's clearly, besides the volume, the calories associated, if you believe in calorie restriction for prolongation of healthy lifespan, this is not something you can follow. And pterostilbene, polydatin are also other polyphenol CF2 inactivators that would require too much consumption of calories and products. Omega-3 that are so important for health span strategies. If you need to assume 5 grams omega-3, you would have to assume 6 kilograms of lobster a day or 2 kilograms of tuna. Besides the calories associated, now we have the problem that fish is frequently contaminated with mercury or other contaminants. So it is a challenge. Like in Florida, we are told that don't eat grouper more than once every other week. And if you're pregnant, you cannot consume swordfish or tuna. And so contamination of the water is a big issue as well. The same for vitamin C or vitamin D consumption. You would have to consume 90 eggs a day to get 4,000 units of vitamin D3. That is what we recommend. So fortunately, we can, it's not just mesenchymal stem cell, but we also have molecular strategies that can help us prevent some of this age-related, unhealthy age-related disease condition in combination with healthy nutrition and physical activities. Not that you can just take a pill of omega-3 and then go and eat 5 pizza and French fries and hamburger and feel fine. So these are helping protective molecules in combination with a healthy lifestyle and nutrition, not just as a single bullet that can fix every one problem. So omega-3 have been very important because they've shown that can not only reverse type 1 diabetes, autoimmune disease in animal models, preserving the green cells that produce insulin, but it's been very important that they show that in human cells, peripheral blood mononuclear cells with subject with type 1 diabetes, but also in subjects with no diabetes, if you give omega-3, you increase the level of regulatory T cells, and you decrease the level of Th17 that are the bad aggressor cells in autoimmune diseases. But even more remarkable is that if you increase the omega-6, like arachidonic acid, you wipe out regulatory T cells and your aggressive cells go through the roof. So what this means that you can have a situation of predisposition to triggers to autoimmunity or severe COVID, just having an imbalance that is diet related. You have low omega-3 and high omega-6, you're in a situation you're unable to react and protect your system, modulate your immune system, your inflammatory responses if you encounter, like, could be SARS-CoV-2 in the case of COVID, or an enterovirus in the case of type 1 diabetes, creating a situation where you're unable now to react and compensate to continue to live healthy. So this was a theory years ago. I'm happy that now there are more and more studies, like the VITAL study showed even 39% reduction in all autoimmune diseases in subjects that are already taking this supplementation for more than 2 years with vitamin D and omega-3. We have now more data coming from the EPIC Interact study showing that in subjects with high GAD65 antibody, when subjects have an autoantibody that predisposed to the risk of developing type 1 diabetes, if they have low omega-3, they have more than 4-fold higher risk to develop diabetes. So this shows how omega-3 can be important. Now this vitamin D deficiency, this is a very recent study published in the Annals of Internal Medicine showing how vitamin D deficiency increased mortality risk, all-cause mortality risk, is cancer mortality, respiratory mortality, cardiovascular disease mortality, and all-cause mortality. You see, as vitamin D goes below 50 nanomole liters, you start having this dramatically increase in the risk of death. So that is what we're trying to combine the strategy. Mesenchymal stem cells have similar effect as vitamin D and omega-3 as anti-inflammatory modulation of inflammation and immunity. And we recently published a study how these cells can triple the lifespan in progeria mice. That is if diabetes is a model of accelerated aging, where we show that these cells can protect from the development of chronic complication. Progeria is a model of very accelerated aging. Children can, with progeria, die when they're teenagers. Generally, they rarely reach the 20 years of age. And in mice, this is much faster, but we show that in using these youthful cells, you can triple the lifespan of the mice, and how this effect is largely mediated by exosome and extracellular vesicle, with our nanoparticles secreted by the stem cells that are responsible in large part for their biologic effect. So to address all these problems, we started the so-called Batman project with collaborators in Europe, thinking, what can we learn from bats? Because bats is an interesting, yes, they can transfer viruses, as we are deeply aware of the COVID-19 pandemic, but they are also resistant to viruses. They don't develop autoimmune diseases, and they live like 10 times longer than equivalent size animals like rats or mice, even if they are not rodents. But if you think that they can live 40 years while rat and mice live 2 to 3 years, it's amazing to see how these things that are associated to resistant to viral diseases, resistant to autoimmune disease, can also be associated with an amazing increased healthy lifespan. And bats has evolved doing this through 70, 80 million years of evolution. And we want to now learn how to apply what bats have learned to respond and make the human race pandemic resistant. So Batman project, I was criticized because it's not gender neutral. They asked me why not Batwoman or Bathuman. I said, sorry, it was just a movie, but to avoid any polemic, we converted the title in Fit for Pandemic, which is now also fit for healthspan.org. You can check this website, open access on the web for for suggestion, and our is a live website. Every time there is a new paper, we posted there a new evidence supporting this combination of strategies of vitamin D3, omega-3, and polyphenols and sirtuin activators that are present in different formulation. And when we saw that this combination was protective against age-related disease, I said maybe it has an effect on COVID, because COVID is also linked to age, chronological age advancement, the risk of severe COVID. And I was expecting like a 10–15% improvement in COVID situation, but I was very impressed by observing that there was a 99% reduction in viral replication if you assume this combination of polyphenols and sirtuin activators, and that you don't even have to take it preventively. It's even sufficient if after infection. Post-infection was equally effective as if you take it before, during, and post-infection. So this for sure you will hear more about this. That was done by several institutions in Europe, including the Anna Teresa Palamara, who is now the equivalent of Tony Fauci at NIH, but is at Istituto Superiore della Sanità in Italy, and many other scientists in Europe. So this is encouraging. What about vitamin D? Well, now there is a huge paper that came out from Israel showing that studying over 1,170 patients admitted, those who had records of vitamin D levels prior to infections show that if you have low vitamin D levels or vitamin D deficiencies, not that you have 20% more or twice as much as there is, but you have 14 times more likely to have severe or critical disease, so that pre-infection deficiency of vitamin D was associated with increased disease severity and mortality. And that's why there has been even a letter, a white paper presented and signed by over 200 scientists worldwide, imploring to increase the level of vitamin D also for COVID protection. This shows an inverse association between omega-3 and severity of COVID. So show again why the combination of omega-3 and vitamin D could be mutually beneficial. No patient in the study were vaccinated against SARS-CoV-2, but a low omega-3 index was associated with increased likelihood of developing severe COVID. So basically, we said the challenge is that in 20 years, the population over 65 will double. We describe how 90% will suffer one chronic disease and accounting 90% of healthcare costs, and how life expectancy, healthy life expectancy by 1 or 10 years can benefit $38 to $370 trillion to the global economy that we could use to other very important challenges facing humankind, from global warming to sustainable agriculture, hunger, and migrations problems. So it is, we don't need to spend all this money in healthcare for preventable disease condition. That's why we're now addressing the strategy, try to prevent progression of disease conditions that are unhealthy age-related, using mesenchymal stem cells and their product like exosome, extracellular vesicles, to try to reverse disease progression, or at least block its progression towards end-stage renal disease that would require, for example, dialysis or renal transplantation, or other diseases like neurodegenerative, lung disease, heart disease, and other chronic age-related or unhealthy age-related disease condition. And I'm thanking you for your attention. And as concluding consideration, we can think that perinatal stem cell may change healthcare as we know it today. There are over 1,100 clinical trials with mesenchymal stem cell therapy ongoing as of last month. And the best source of perinatal MSC, exosome, or extracellular vesicle for each indication will need to be assessed, including combination products, or whether we'll use autologous versus allogenic sources of these cells, considering their antigenicity, immunogenicity, and risk for allosensitization, as well as defining ideal dose and route of administration. So still a lot of things and challenges to be addressed, but a lot of promise, and while patient safety remains central, we must also define a regulatory path that will allow for timely and cost-effective clinical translation, as final product manufacturing costs will affect reimbursement and our opportunity to help hundreds of millions affected by the pandemics of the 21st century, which are viral like COVID-19, autoimmune diseases like type 1 diabetes, and unhealthy lifespan-related diseases, as we discussed before. So in summary, there is no cure without prevention is my slogan and the slogan of many others, so that we have to prevent disease, halt disease progression, reverse disease, but also prevent disease recurrence. That's why diet, lifestyle, physical activity, protective molecules, and regenerative medicine strategies like the cell therapies that we described will become central to change healthcare as we know it today. So thank you